why it can be so difficult to treat? Here's the statistics on the best oral medications published right now. Lamisil, a trial of 508 patients, 46% had a complete cure in 12 weeks, which is pretty good. But it's also a half chance for a pretty potent drug in your system. They followed up longer for 16 weeks, and 55% had a complete cure. Itraconazole is another one you may have heard of. Long-term follow-up, 144 patients. 46% cure rate at 54 months. How long is that? It's 4.5 years you got to take that drug. That's a long time. Subsequent retreatment with terbinafine, so you take itraconazole and terbinafine, and you might get a cure rate up to 88%, which is pretty good, but could do harm, right? I personally don't prescribe that first. Here's another drug that you may not hear a lot about because the cure rate's around 47, 66%, but there was no statistical significance at those numbers. If you ran significance, it was around like 13%. So the authors concluded that other authors are overestimating their cure rates. And sorry, here's the one that's the weakest. Sorry, I said that wrong. This is the one that 460 patients, 48 weeks, 29 to 36%. So it's a pretty good gamble of what you may or may not get with the oral antifungal medication. Make sure if you go that route, you do run those tests to check your liver, because it can be harmful. I'm always trying to go this direction, right? Maximum reward with least amount of risk.